Welcome back. The last Saturday in August is known as National Overdose Awareness Day. It's all meant to educate and inform millions of people about the dangers of overdoses, but also what can be done if someone you know or love does actually overdose. Rochelle, you're here with Hegira Health to tell us more.
Yeah, Sandra, I'm here with Carol from Hegira Health. Thanks so much for being on with us this morning. A very important topic. And part of the reason we have you on, August 31st, designated as Overdose Awareness Day all across the world. Tell me why it's so important to talk about this.
Well, again, I thank you so much for having me on this morning and for the opportunity to talk about overdose awareness. So we lost 107,000 people in this country alone last year, and it's been an escalating problem for decades. And we need to educate. Reducing, eliminating overdose is really about awareness, people being educated and knowing how to prevent and how to stop an overdose when it's happening.
Let's talk about that prevention, talk about stopping it. I know I read that in 2023, we saw a decline for the first time in several years. What do you attribute that to, the decrease in the number of deaths? Is it conversations like these? Is it resources? In your opinion, what progress are we making?
So we are making progress, but the progress that we're making is just a dent. So programs like harm reduction. We're lucky to live in a state like Michigan that really supports media, supports public policy, has reduced the criminal issues related to substance use, has increased medication-assisted treatment, and increased programs like Narcan that reverse overdoses as they're occurring. It's really also very important to recognize that 5 years ago, just short 5 years ago, we had 67,000 deaths in Michigan. So we've almost doubled. So we're denting it, we're making improvements, but it's a serious problem.
I love that you talked about those resources. We just had a segment earlier in the week on naloxone and just how accessible that is, and paramedics, police, firefighters leaving it with loved ones of those who have experienced an overdose. Something else I want to get your opinion on. Do you think we've helped with the stigma a little bit? I know in recent years, I haven't heard the word, like junkie and things of that nature as much. There seems to be a little bit more sympathy, a little bit more empathy for those struggling with this, and optimism they can come out on the other side. Absolutely.
So we're really pushing and stressing, understanding that addiction is a brain disease, and helping people to move from that darkness, that substance use and misuse addiction, that it's a character disorder and it's a character flaw. It's not. It's a medical illness. And with that knowledge about medical illness comes compassion and increased exposure and access to treatment.
Can you quickly, for those that this is just striking a very personal situation for them, provide some optimism? Because I can't tell you in this field how many stories I've covered where somebody really struggles with addiction. They do come out on the other side and they're clean for 10, 20, 30, 40, 50 years.
Absolutely, and lead wonderful and productive lives. So there is just so much progress in our treatment and our evidence-based treatments and the way that we are able to help people overcome their addictions. And a lot of that is our understanding of biology and genetics and how the environment that people are in influence their addiction and their path towards recovery. So there is absolutely optimism. There are absolutely a lot of people out there and a lot of people working in the field now that are available to help others see for themselves that overcoming addiction is possible.
Where can people go for more information?
So for Hegira Health, you can go to our website at www.hegirahealth.org. If you just simply Google addiction treatment, addiction prevention, you'll find tremendous resources available in every community.
Lots of science-based hope kind of paired with the dedication from people like you. We appreciate your time this morning.
Thank you so much.
Thank you.